Hello, this is Dr. Gay from First Lake MRI, and this is an 18-year-old male with history of prior shoulder dislocations. And we see here an axial protein density fat suppressed image of the left shoulder joint. We can see the round ball of the humeral head. We can see the glenoid here that looks like a golf tee. And the main problem is right here along the front. The anterior rim of the glenoid is fractured. You can see the back rim is nice and sharp. And here this is blunted, and this is the bone fragment that's free and elevated. This is the anterior joint capsule and periosteum. This is periosteal stripping, and the periosteum is still attached to that bone fragment. So this is what we call a fibro-osseous Bankart lesion, and it's related to a shoulder dislocation. And the main findings are the size of the bone lesion. If it's more than 25% of the AP dimension of the glenoid, it may have surgical implications. So I usually mention the size and AP dimension and also vertical dimension. We can see the vertical dimension better on a sagittal image like this. From here down to here, here's the front, here's the back, the coracoid process, you can tell where the front is. And again, the fracture goes from here down to here. Now, these patients almost always will have a Hill-Sachs impaction injury of the humerus, so we're looking at the posterior, lateral, superior aspect of the humeral head. You can see right here, nice rounded contour, and right here things are flattened a little bit of marrow edema. So this is the Hill-Sachs impaction injury that goes along with this dislocation. Now, one other thing, this looks like more of a chronic injury. We can see that the cortex, this looks like it's corticated, the fracture. So since this is nice and dark, just like the cortex elsewhere, we know this is an old rather than an acute fracture. So this shoulder is definitely unstable with this fracture and the periosteal stripping. And this is an old fracture here, but an acute bone injury here in the posterolateral humeral head, so we know that they've dislocated recently. So this will definitely have to be fixed surgically. So in the end, we have a fibro-osseous Bankart lesion that is chronic with an acute bone contusion related to a Hill-Sachs impaction injury. And if this were just the labrum torn in the joint capsule, we call it a fibrous Bankart lesion. But since the bone is also involved, this big bone fragment, we call it a fibro-osseous Bankart lesion. Thank you very much.